Hello everyone, welcome back to my channel. If you are new here, I talk about medicine and lifestyle in general. Today we are going to be talking about hypertension, also known as high blood pressure. You probably heard it as silent killer, but what does that really mean? Don't worry, I'll break it down step by step in the simplest way possible, and I'll also share practical tips you can start using today to protect yourself and your loved ones. First, let's understand what blood pressure is. Imagine your blood vessels are like water pipe in your home. Then the heart pump blood through this pipe, just like water flow through plumbing. Now, blood pressure is the force of blood pushing against the wall of your arteries. When the pressure is normal, the blood flow smoothly. But when the pressure is too high, it is like water running at a high force through a pipe. It starts damaging the walls over time. That constant high pressure is what we call hypertension. The normal blood pressure is 120 systolic, 90 diastolic. High blood pressure is more than 140 systolic, 90 diastolic, measured in two different locations, which means your doctor have to measure it two different times before diagnosing with hypertension. Blood pressure is to be measured after taking at least 30 minutes of rest upon reaching the hospital. Hypertension is sometimes called the silent killer because most people don't feel any symptoms, but it is quietly damaging the vital organs. Over time, it increases your risk of stroke, that's when blood flow to the brain is blocked, heart attack, when the heart doesn't get enough blood, kidney damage, since the kidney filter your blood, high pressure wears them out, vision problem, it can even damage tiny blood vessels in your eyes. That is why knowing your numbers and checking it regularly is so important, even if you feel fine. Now you might ask, why does blood pressure go up? There isn't always one single cause, but here are the most common risk factors. Eating too much salt and processed food, not exercising regularly, being overweight or obese, smoking and drinking of alcohol, too much stress, family issue. If your parents had it, you are at higher risk. And of course, age. Blood pressure tends to rise as we get older, even though now we see it in younger ones. The scary part is many people combine several of these risk factors without realizing it. Here is the tricky part. Most people with hypertension don't feel anything. That is why it's called the silent killer. People may notice headaches, dizziness, or blurry vision, but this usually happens when the blood pressure is dangerously high. Sometimes, by the time patient presents to the hospital, they've developed complications. So the best way to know is not by guessing, it is by checking your blood pressure regularly. The good news is hypertension can be prevented and controlled. Here is how. Eat healthy, cut down on salt and processed food. Add more fruits, vegetables and whole grains to your meal. Exercise regularly. Even 30 minutes of walking a day can make a big difference. Maintain a healthy weight. Even losing a little weight can lower your blood pressure. Limit alcohol and stop smoking. These both raise your blood pressure and harm your blood vessels. Manage stress. Try deep breathing, prayer, meditation, or journaling. Take your medication if prescribed. If your doctor gives you a blood pressure medication, don't stop it on your own. It only works if you take it consistently. Check your blood pressure often, at home or at the clinic. Knowing your numbers gives you power over your health. So to keep it simple, hypertension is when pressure of blood in your arteries is too high. It often has no symptoms, but it quietly damages your heart, brain, kidneys, and eyes. The good news is, with healthy life choices and proper medical care, you can prevent it, control it, and live a long, healthier life. If you find this video helpful, please give it a thumbs up, share it with friends and family, and don't forget to subscribe for more health and lifestyle tips. Remember, small changes in your daily life can make a big difference in your health. Stay healthy and see you in my next video. Bye.